Good morning, Illini, and welcome back. I'm your host, Matt Schrock, here for Healthy Illini, and we are glad that you're with us today. We're in the spring season, and Illinois weather is Illinois weathering. It may be snowing today, it may be 90 today, it may be hurricane season. We don't know, but we're glad you're here listening with us. Today, we have another informative podcast about some of the services here at McKinley. It's a really important one that you may think you know, but you don't necessarily know everything about. So we're going to jump right into this one. I'm joined today by our guest, Linda Miner. Linda is a staff pharmacist here at McKinley. She's been here about 20 years, and so she's very well versed in what the pharmacy has here at McKinley. But Linda, thanks for being here today and joining us.
I'm happy to be here.
So as I said, McKinley, over a lot of our episodes, we know that McKinley provides a lot of healthcare for our student body and a lot of different aspects. Another aspect of what we do here, not just in the care we give, but is also to try and educate about the care that we give and about the care that you can get through health services. Most of that is because a lot of our students are first-time consumers. This is the first time they're in charge of their own health care. They've been under their parents. They've been guided by that. They really haven't had to make a lot of decisions or really honestly pay attention to those decisions because they've been made for them. But now they're out starting their own journeys, and there's a lot of uncertainty or things they're not aware of. And sometimes it's just going to the doctor. Sometimes that's how you make appointments, things like that. But if I talk to a student and say, what do you know about the pharmacy? They'd probably say, oh, I know that. That's where you pick it up. But there's a whole lot more to that. It's not just walking in, grabbing your prescription and walking back out. And so that's really what I want to talk about today is some of the things that students or anyone starting their health journey may not be aware of. And so we want your expertise. We want your informative opinion on these things as we go. So let's just start with, before you even go to the pharmacist, when you're like, okay, I've got a prescription to go pick up, or I've been prescribed something, whatever. Linda, what are some things to consider when you're going to the pharmacy before you even step into the pharmacy itself? What are some things to be aware of as you're headed that direction?
I'd say you would want to be familiar with your health history, perhaps allergies and any reactions that you've had to medications in the past. Sometimes medications prescribed are similar to one another, and knowing what your reaction to a specific medication would be helpful in knowing which ones are the safest to use.
So, but if you come in, and let's say I come in and I know I'm allergic to penicillin. I'm not, but if I was, and I know I'm allergic to penicillin, I don't need to know necessarily what medicine I'm picking up, how that would react to penicillin. I can ask that question.
Absolutely.
Because that's the thing. I think that's something that is important to make a distinction of, is that you don't have to know all the information. You don't have to be an expert on all this. There's somebody across the counter who is an expert on all these sorts of things. It's just being aware of the red flags or being aware of the important details that you say you are picking up the prescription and you just say, I'm allergic to penicillin. Is this an issue here?
Absolutely, because sometimes at the doctor's visit, things get missed or not communicated well. And the pharmacy visit is another layer of checking with all of those contraindications.
And including with what you might be allergic to, it's also important just to know what you're taking.
Absolutely.
Because cross, medication is a thing.
Yeah.
So how do you, as a pharmacist, someone who works in pharmacy, how do you try and ensure that you educate somebody or be aware of that? Is that something that you bring up, or is it something the consumer needs to bring up to ask about?
So knowing your medication and how you're supposed to take it is helpful, because sometimes the order comes through. Maybe there was supposed to be a change and the doctor forgot to make that change on the order. So confirming what you're picking up is with the new instructions is helpful. Knowing what other medications that you take, including over-the-counter items, are helpful in case there will be an interaction, and we can educate you on what to look for.
I know this is going to be a hard question to answer, because you're going to give a blanket statement for something for medicines, which are very much important not to be blanket statements. Every medicine is different, basically. But let's say that somebody comes in. Is it important to ask, what if I have a bad reaction? What are the side effects? Is that something to ask the pharmacist? Is it something you need to ask your doctor? If you're picking up a medication, are side effects something you need to ask right there?
Both places, because you might get more information at one, and maybe you leave the doctor's office, and after you've had time to think about it, you've developed more questions. You can get those questions answered at the pharmacy.
If somebody is picking up medication, let's say they're not allergic to anything, they're not taking any current medication, they don't have any of those risks that health risks that might play into what they're taking. Does that mean they don't really have any other questions to ask? Are there just general questions
no.
to ask?
Sure, certainly. you'll want to know what the medicine is for. What's it supposed to do for you? How will I know if it's working? So that's helpful to find out. You should also know how it should be taken, how often, what time of day, and how long do I take it for? What do I do if I miss a dose? Some medications you wouldn't want to duplicate a dose too close together. So that would be helpful to know how your medicine works and whether or not you should go ahead and take it when you forget or when you realize you forgot the medication, or if you should just skip that day's dose and pick up with the next day's dose.
What is the difference? Because I've seen this on some medications I've had, my kids have had. Like if it says, PRN, what is PRN? What does that mean?
It generally means just as needed. So particularly over-the-counter medications, they're used to treat a symptom that you're experiencing, and it may not prevent the condition from happening. You're just making the symptom that it's causing a little bit less intense. So if it's not so severe, you may not need to take it. So it's as needed. If the symptom comes back and you've waited the proper amount of time between doses, you can repeat the dose. But if the symptom never comes back, you don't have to keep taking it. There are medications, though, that you do want to finish the whole therapy. The first one we all think of is our antibiotics. We don't want to build resistance to antibiotics by stopping our therapy too soon. So you do need to finish the course of therapy on antibiotics.
You started to answer the next question I had. I'm going to kind of jump in and ask you to explain on this one a little bit, because I'm going to tell myself I'm really bad about this. I give some antibiotics. I don't feel good. It's for 2 weeks. 5 days in, I feel better. I don't need to take this anymore. I'm good. Why is it so important to finish out that 2 weeks, even though I'm feeling good after 5 days?
So the antibiotic that you took was being effective, and it's working with your own immune system. Everything's doing what it's supposed to do. Maybe there's a majority of the bacteria that it's treating is on the way of decreasing, but there's some strong bugs that are probably just lying low in your system, and then you stop taking the medication, but they never really were eradicated, and then they start to grow, and then they become stronger. But guess what? They had 5 days of being exposed to your antibiotic, and they got really smart on how to get around growing despite that antibiotic's presence, and now they're resistant to that antibiotic, and that same antibiotic may not work for this same infection anymore.
No, I feel really bad for all the times I did.
It's a learning experience.
Because, I'm in my 40s, and it's something I still have to force myself to do sometimes. Most of these things, like how to take it, things to avoid, they'll be on those instructions that you get with the medication. But would you say it's always a good idea to ask those anyway, even if it's listed there or not listed there, just to make sure you're...
For sure. Verbal communication is always a good way to communicate understanding. Maybe it says it on there, but you're not real clear about certain things, particularly when doctors write in a range that you can do 1 to 2 every 4 to 6 hours. Well, what do I start with? Do I start with 2? Do I start with every 4 hours? And so getting some guidance on how to start is always a worthwhile question.
And another important question to ask about is refills. How does that generally work with medicines?
So what a refill is when you have your visit with your doctor, they prescribe it. They give authorization at that time whether or not you can pick up another supply of that. And they will authorize how many refills they are giving permission. And that refill is associated with that order from that day's visit. And the pharmacy will dispense the original quantity that was authorized. And when you deplete that, if your condition has not resolved, or if it's maybe a chronic issue that you have to keep taking all the time, then you will want to ask the pharmacy to get your refill ready for the next month.
I like one of the comments you made on our prep work, which is really important, because I've been guilty of this, is that you said, have your questions, but never leave confused or having unanswered questions. And I have done that. I've gone to a pharmacy. I walk out in the parking lot. I call, my wife, and then ask a question. I'm like, I don't know. I'll say, I'm really not sure about this. I don't know why, but I leave without all my answers. But, the pharmacist, the pharmacy techs, you're there to answer the questions.
Absolutely.
That's what how important it is. And so it's really important not to leave being uncertain.
Yeah. And sometimes you don't think of those questions till you get home. You have time to process things, and it's okay to give a call to the pharmacy later.
That was going to be one of my other questions, that if you do get home, you have a question or something's not going the way you think, or, you forgot something, because sometimes if you get 3 or 4 medications, that's a lot of information to try and keep track of sometimes.
And if you're not feeling well, you're not on the top of your game.
Yeah, it's okay to call back
Absolutely.
and ask those questions on there. One thing I do want to kind of touch on, which is kind of tricky because we're talking in general pharmacies, we're also talking McKinley, which is kind of unique, is insurance and insurance cards. So generally, it's just important just to have, your insurance information going in to know what's covered and what's not. How does that work here at McKinley? Just a real quick.
Absolutely. Yeah. So it is helpful to know what you normally pay for prescriptions when you fill them at home, so you have something to compare to. But when you visit McKinley, we're not going to process your prescriptions through insurance. Our prescriptions, we self-manage the cost of all of our expenses through the health service fee that all full-time students pay to the University of Illinois. And we have our own pricing, and you can find that on our website, mckinley.illinois.edu. Go to the pharmacy page, and you will see a list of our formulary there. And if our price is cheaper than what you pay for your medication at home, have your prescription sent to McKinley Pharmacy. Your doctor can e-scribe it. If you have refills at your pharmacy at home, you can ask McKinley to transfer your prescription to McKinley, and we have an application that's found under My McKinley. Look for pharmacy services, and you can ask for us to call that pharmacy and get those refills transferred to our pharmacy.
A lot of what we're talking about does pertain to the wider, just any health consumer pharmacy kind of thing, but that was very specific to McKinley. I have one more question. It's kind of specific to our university. It can go to other campuses as well, but one of the questions or one of the issues students often run into is, we're in April, it's spring, end of semester's coming, and then summer, and students may be going back home and they need refills before they go, or they're going overseas, or they're going on an internship, whatever. If they need to find out about how they get refills before they leave, or they need to find out if they can get refills before they leave, what do they need to do? Who do they need to contact to find out about, make sure they have their medication for wherever they go when they leave campus?
Sure. So they first need to find out how many refills are on their prescription. Are there enough refills that they could purchase enough to go home from McKinley? The other thing to look at is what kind of the medication is. Not everything can we sell several months in advance of, like controlled substances. We are limited. We can only do a 30-day supply of that at a time. So in that situation, a student could ask their pharmacy at home to call us for the order, the refills, as long as they've picked up the first fill at our pharmacy. A prescription on hold that's never been filled, meaning that ordered on that specific day from the physician, if it's never been picked up at the original pharmacy at least one time, it is not legal to transfer those to other pharmacies. It has to have been picked up one time at the pharmacy that received the order in the first place, and then remaining refills can be transferred. The other thing that we're limited by is, did your doctor authorize us to be able to give you 4 months of medication all at one time? Now, insurance companies are going to put a limit on that. If you try to go fill a prescription at your pharmacy at home and say, I'm studying abroad, I want to take 4 months with you, your insurance is probably not going to allow that to happen. They put a limit that you can only get 1 month at a time, or maybe 3 months, depending on what kind of policy you have. But here at McKinley, since we're not billing insurance, we have some flexibility. So as long as the doctor has authorized us to dispense enough to last you over the summer, we're more than happy to provide that for you. If you stop in at the pharmacy before you leave town, that we can get that ready. And I would prepare early because the lines will be long.
I was going to say, one of the important things that you've said here is that, and again, contact the pharmacy, call and find out, because you don't want to wait, you're leaving on Friday, come in on Thursday. I'm trying to figure this out. That's going to be a tough situation. Make sure if you're listening and you're uncertain, or you think, oh, I do need this, get on it now, and start at least finding out what the information
educate
is.
yourself. Yeah,
to get the education of what you need. That way, when it does come to that time, you're not trying to sort it out while trying to get it put together.
Because that $5 price that you've been getting all semester long, it's because you've paid the health service fee for the spring semester. If you're not registered for classes on campus over the summer, you're not going to be charged the health service fee, so you don't have coverage at McKinley for the summer months. So what we do in that situation is you'll just have to pay a little bit more, what we call an extension price for your prescription. And a lot of times it's only maybe $2 more than the $5. Some medications, it is more, and you don't want to pay the extension price with us. It would be cheaper for you to use your insurance and fill it at home.
And again,
depends on the drug.
Again, if you're on campus here at UAUC and have a question, call McKinley. They're very well versed in this. The pharmacy team is very good at assisting and informing on that. So if you have questions, please give them a call and ask. Okay, let's go back a little bit. We've talked about kind of questions to ask, what to do when you're at the pharmacy, but now you've gone home. You've got your stuff. You don't have any questions. You're at home. But what are some important things to think about, like when you have that medication at home? Like, can you just set it anywhere in your house? Is there somewhere in particular? Are there any advice you give on how to take care of this medication that you've just been given?
Sure. So you'll want to store it in a place that is not going to expose to a lot of humidity. Humidity starts medication to disintegrate. So it won't be good as long as the expiration date that was given to it from the manufacturer. And so a cool, dry place is the best place to keep it. So not in the bathroom, where it's easy we keep it by our toothbrush often, right? Because that helps us to remember to take it every day. But actually, that's probably not the best place for the medication to be stored. You want to store it out of the reach of children or your pets, because that would be very dangerous if they had access and accidentally consumed your medication for them. You want to store it out of the reach of children and your pets, because we want to keep them safe. It would be very dangerous if they were to consume your medication.
Okay, we've asked a question at the pharmacy. We've gone home. We're doing a good job of taking care of what we've got, storing it, keeping it safe. And we're talking about safety here for a minute, which leads me to, again, on campus, people get to the end of the semester, they're leaving, and they've got these medications they don't need anymore, or they're not taking with them, or whatever. I know that it's something that we hear about from housing here a lot, that, they clean out the dorms and somebody forgot medication, or they just left medication. One of the discussions that's on campus right now is helping educate on proper forms of disposal, how to get rid of excess medication if you have it. So what do you do about that? And why is it so important to dispose of medication in a proper way?
Well, let me answer the second question first. Why? It's important to reduce risks of accidental injuries. We don't want our children or pets to accidentally overdose on a medication just because we had it laying around. And then security reasons, that it increases the chance of somebody who was never intended to take that medication to acquire access to it and, do what they wish with it. So it decreases the opportunity of that. The other reason why we want to get rid of things is in a safe way is to minimize the impact on our environment. So to answer your first question, we have proper ways to dispose of medications that keeps it out of our soil and our water systems. So the worst thing to do is to flush your medication down the toilet. That is a practice that used to happen when we were not so environmentally conscious, but we don't want to do that anymore. Some pharmacies will give you things to mix with the medication, and that makes it supposedly safe to put in the garbage. But the best way is to participate in drug take-back programs. There is a national prescription drug take-back day that's all over the country, and it usually coincides with Earth Day, which is coming up. And here at McKinley, if we fill the medication, you can always bring back prescriptions that you picked up from us to us, and we will make sure that it's disposed of properly. We are in the process of acquiring a receptacle that we haven't been able to secure the purchase of it yet, but that is coming in the future. So look out for that. It'll be a container that you can put the medications in on your own. Other pharmacies do have that. A lot of retail chain pharmacies have that also.
So it's just a matter of just taking that extra step and being sure that it's taken care of in a way that's not going to impact the environment, that's not going to increase any risk of anyone around you. And it's kind of a peace of mind kind of thing.
Sure, we're being good, of our earth. And part of being good stewards is to maybe evaluate our processes for creating wastes, including unnecessary medication. Here at McKinley, we do give out a lot of things for free that there's no additional cost to. So we ask you to be a wise consumer. If you're really maybe not ready to need that medication, should you take it with the chance that it's never going to get used and then it expires and then we have to dispose of it?
One other question about the disposal medication. Is it important to take the label off? Is it important to scratch out your name or any of that kind of information? Because you got some personal information on this.
Absolutely.
And it's important to keep that information when you're taking the medication. It's important to keep it in the original packaging, but when you're trying to dispose of it, is it important to get rid of that?
What I do is I pull the top of the label off that has my name and my address on it, and I leave the bottom portion of what's in the medication on the label. Every program that accepts medication, I don't know if it will help them because somebody's got to go through all of that medication, right? Do they need to know what is in that bottle? Maybe, maybe not. I don't know. I've never had that responsibility before. I'll find out when we get our receptacle, but I do take all of the private information off of the label.
Yeah, it's one of those that, you don't know if they need that information, but it's better to have it and not need it than need it and not have it. So as long as you take your personal information, that's okay. Going back to the personal information on medication, kind of want to circle back a little bit. Another question for safety's sake, my roommate goes to the pharmacy because they've got a sore throat and they were prescribed something for strep, let's say. And they've got their medication. Well, now I'm starting to feel a little bit of a sore throat. It's okay if I take that medication too because we got the same symptoms, or is it not?
Well, it depends if it was prescribed just for you. We'll just get kind of basic here. There are prescription medicines that are only legally acquired through an order through a provider. And then there's over-the-counter medication that anybody can go buy over the counter or obtain at McKinley. Prescribed medications, it is not safe to share. Counter items that are labeled for consumption with the directions on them, those things, yes, it's appropriate to share that with your roommate.
That's probably the best explanation I've heard because it does depend. And this kind of brings us back to the central focus on this is that if you have questions, call the pharmacy because you've given very informative and really good explanations of things, but every medicine is different. And so you've given some very general terms on things that when you're giving out medicine, it's going to have specific instructions to.
Yeah. And everybody's on a different combination of medications, right? And so you have to look at what this person is on. Just because it's safe for them to take this over-the-counter medicine or prescription medicine, it may not be safe for another person because they have a different medical history or a different chemical makeup or just on different medications.
As we're coming towards the close of this, I do have another question. Let's say that I have a question about medication and my pharmacy is closed. Most pharmacies are closed. Who do I contact in after hours? Say it's 2 a.m. and I've got a question about something I'm feeling or my medication. Is there anyone I can contact? Are there any resources with that?
At McKinley, we refer everybody to call the dialer nurse, 217-333-2700, and follow the prompts for dialer nurse.
And then you can get your questions answered, whether it's a medical question or a pharmacy question. That's just a great resource to use.
Absolutely.
Linda, thank you so much for being here. I know I quizzed you. You probably feel like you've been grilled a little bit, but it was fantastic. And you just gave such really informative answers. I just really appreciate you taking the time. Thank you.
I appreciate the opportunity. And there's just too many scenarios to give specific answers. So that's why, Matt, I appreciate you pushing home the fact that just stop in and ask us, pick up the phone and ask us. We're here to help you.
Thank you so much. I appreciate you being here.
Thank you.
One of the things that McKinley is here for is to educate. We're here to serve. We're here to check out, give you medical diagnoses, distribute medicines to the pharmacy. You got, all the things that we offer. But one of the major things we do is educate. And it's important to know what questions to ask, what questions you can ask, how to approach We've talked about it with doctor's visits. It's the same thing with pharmacy. Coming in and then going out feeling informed, feeling comfortable with the medication you have is so important. So if you've heard nothing else today, the thing you hear is call and ask questions, because there are so many different variables when it comes to medication, when it comes to your treatment and care, that it's important to know what the information is, how it affects you, what to look for, things like that. We have resources in the bio, as always, and ways for you to contact and ask, whether you have an immediate question or a question later on in your treatment. But please reach out, get those questions asked so that you are in the best position to be well that you can be. If you have any questions on this, you want to talk about the topic more, or you want more information, by all means, contact us here at Healthy Illini. We want to engage in these conversations. That's why we do this, so that we can help answer whatever questions you have on any host of topics. If you want to hear more, or you want to hear more in depth, we want to know that so that we can serve you through this platform. But thank you for joining us today. You're on a personal journey no matter where you are in it. You are important. You matter. Your health and wellness are important and matter. And we're here to keep you well to excel. So go have a great week, Illini. Let us know how you're doing, and we'll catch you next time on Healthy Illini.